Hello, my name is Rosalie Magbu. I am a clinical doctoral research fellow at Queen Mary University of London, a senior sister in intensive care unit at Bart's Heart Centre St. Bartholomew's Hospital, and a Connect member. Today I'm going to talk to you about surgical site infection in focus, assessment, prevention, and management. Surgical site infections are serious complications accounting for 20% of all the healthcare associated infections and are considered to be the most frequent type of hospital acquired infection in Europe and the United States. Although SSIs are among the most preventable hospital acquired infection, they represent a significant burden in terms of morbidity, mortality, and additional cost to healthcare system. In cardiac surgery, 3.6% of the patients who have heart operations experience an SSI. Although the mortality related to SSI is only about 1.6%, the mean additional hospital length of stay can be up to 12 days, which results in extra hospital cost of £8,500 or €9,500 per SSI infected patient. This does not include the indirect costs due to patients' temporary or permanent incapacity to work, income lost by family members, forgone leisure time, travel, and home care costs, which can account for up to 8 times the direct cost of SSI. Furthermore, patients with SSI may experience additional pain, delayed wound healing, and be more susceptible to secondary infections such as bacteremia. It may also have a negative impact on patients' mental health as a result of prolonged hospitalization. So, how do we define surgical site infection? Based on the Center for Disease Control and Prevention's definition, SSI is defined as any incisional, superficial and diff, and space or organ infection occurring within 30 days postoperatively after initial procedure or up to 12 months postoperatively if the procedure includes an implant. It should also include more than one of the following factors, including past discharge on incision, organism isolated from an aseptically obtained culture, an abscess or other evidence of infection that is found by the surgeons at the time of pre-operation, percutaneous drainage, or by histopathological or radiological procedure, and a diagnosis of an incisional or organ space SSI by the clinician. Infections after surgery are caused by germs, which can be already on the patient's skin that spread to the surgical wound, inside the body or from the organ on which the surgery was performed, or from the surrounding environment, such as from infected surgical instruments or on the hands of the healthcare providers. However, some patients may have higher risk of developing SSI, particularly those who have poorly controlled diabetes, problems with immune system, or those who are taking corticosteroids, high body mass index, or are those who are obese, currently or recently smoking, and those who have surgery that lasts longer than 2 hours. Assessment of an SSI includes looking for local signs and symptoms of infection. For example, heat, redness, pain, and swelling. In more serious cases, systemic signs of fever or a raised white blood cell count might be observed. Visually, infection in the surgical wound may prevent wound healing, causing the wound edges to separate, or it may also cause an abscess to form in the deeper tissues. Severity of SSIs may vary, and this should be taken into account when comparing reported rates of SSI. In the United Kingdom, it is recommended that patients undergoing elective cardiac surgery should have a preoperative assessment to stratify risk of SSI, which should be used to inform the consent process and reduce the risk of SSI. Although there are several risk stratification tools for cardiac patients, such as the BART surgical infection risk tools, the Brompton and Harefield Infection Score, and the Australian Clinical Risk Index, there is currently a lack of evidence as to which of these tools are the most valid and reliable to be used in clinical practice. In terms of management, most SSIs can be treated with antibiotics. We have to give our patient an antibiotic that covers the likely causative organisms. Remember to consider local resistance patterns and the results of microbiological tests in choosing an appropriate antibiotic. Sometimes, additional surgery or procedure may be required to treat the SSI. During recovery, make sure that friends and family members wash their hands before and after they enter the patient's room. Also ensure that doctors, nurses, and other caregivers wash their hands too. Other preventive strategies that we do includes preoperative showering, nasal decolonization, antibiotic prophylaxis, antiseptic skin preparation, and hand decontamination. However, a recent national survey in the UK of SSI prevention strategies demonstrated significant variation in care in cardiac surgery centers, which is also reflected in our center. To address the issue, a cross-departmental network of SSI champions has been established at Bart's Heart Centre in London. Here is my colleague to tell you more about the roles of the SSI champions.
The SSI champion work together to standardize local practices for the prevention of SSI after heart operations. We deliver a series of multidisciplinary teaching to keep all staff members informed and promote adherence to our local SSI prevention protocol. We conduct regular audits on various SSI prevention strategies to assess staff compliance and identify areas for further teaching.
Nationally, ongoing research is also being conducted to standardize prevention practices. For example, the Cardiothoracic Interdisciplinary Research Network, which is a collaborative research group of healthcare professionals in cardiac and thoracic surgery in the UK, have designed a program of research that will develop a new way of working out each patient's risk of developing an infection.
Greetings, everyone. My name is Luke Rogers, and I'm a cardiac surgical registrar at Bristol Heart Institute, University Hospitals Bristol and Western NHS Foundation Trust. I'm co-founder of the Cardiothoracic Interdisciplinary Research Network, or CIRN for short, with Mr. Ricky Vajja, and I'm delighted for Rosalie's invitation to discuss a little about target wound infection with you all. Thank you, Rosalie. As you have already heard, a significant knowledge gap exists in how professionals prevent, diagnose, treat, and monitor surgical site infections. This, at least in the United Kingdom anyway, but I suspect across the globe, has resulted in significant variation in how surgical site infections are prevented and managed. In an effort to tackle this and provide an evidence base for intervention, the CIRN developed the Target Wound Infection Programme of Work. Funded by the NHR through a programme development grant, we have established 3 work packages to tackle these 3 barriers to effective surgical infection prevention and treatment, with the ultimate aim of 1, developing a nationally validated risk score calculated from routinely collected data, 2, identifying barriers and facilitators to surgical site infection prevention strategies and interventions, 3, developing a national surgical site infection surveillance strategy. Through this work, we aim to standardise the definitions of SSI used across the United Kingdom, and possibly even the globe, develop strategies for the prevention, treatment, and surveillance of surgical site infections that will ultimately be tested in a national, or possibly even international, multi-centre randomised controlled trial. To take part in this work, please follow the CIRN on Twitter at CIRN Network, or check out the website at Target Wound Infection Study in the University of Leicester, of which the link will be provided. Or alternatively, email us at cernetwork@outlook.com to express an interest in taking part when the trial commences. Thank you for your time.
In summary, surgical site infection is a serious complication after cardiac surgery. It can have a huge impact on patients' recovery and experiences, as well as an economic perspective. Given the high burden of SSI for the patient and the healthcare system, effective management and prevention strategies are essential. Thank you for watching, and I hope you enjoyed this video. Please join us in Connect using this QR code.